You're now 60, you said.
Yes.
We're seeing 60 being the new 40, 45 kind of thing. Some patients come in, they think they need blepharoplasty, but in fact, they actually need brow lifting. They may need both, but we could talk about that on another podcast. Right now, people looking at you wouldn't have any clue kind of where to put you in the age. I think you look just...
Yeah, thank you.
Well, and again,
What I like is how much better I look too, and it's only been 4.5 weeks.
to make it simple for the audience, brow lift is rejuvenation of the upper third of the face, and it's largely aimed at repositioning the eyebrow.
Somebody could look at me, and people have, because I had a troll on Instagram say to me, mention and make a comment, they think it's time I get some surgery done. Should I wait?
Clean. I was the troll.
Well, I deleted you.
I had a surgical opening, so I thought I'd put it in.
Tried to fill the day.
I tried to fill the day.
Oh, that's hilarious.
Hey everyone, it's Dr. Solomon. I want to welcome you back to Unfiltered, our podcast. Today we have a few special guests that have agreed to participate in our podcast to discuss procedures from full face rejuvenation, Asian rhinoplasty, African American rhinoplasty, and a few other topics. And I'm going to turn the mic over to Nancy, who's going to introduce you to patient number one, Rebecca.
Hi, everyone. So today we're going to talk about facial rejuvenation. We're going to talk about full facial rejuvenation. This is Rebecca. Welcome.
Hi. Thank you.
So patients come in to the clinic in consultation. Some say to us, okay, I just want to address the lower neck. Then we have patients say, my eyes are looking tired. They're making me look older. I just want to deal with my eyes. And then we have patients like Rebecca who come in and say, I want to fix from here to here. I want it all. Tell me what I need, what's the best strategy to just fix. I want a full rejuvenation, the full Monty. So we introduced Rebecca to Dr. Solomon, and they chatted. And the treatment plan that was developed was a facelift, lower face and neck, a brow lift, and then CO2 laser for the full face. So when you came to see us, Rebecca, what did you indicate were your main issues?
I tend to wear false eyelashes when I do my makeup, and most of the reason I was doing it was because my eyes were kind of drooping at the corners. So I was very self-conscious of that, and I was super self-conscious of my neck. Like, don't look down, always look up. Like, because it would just be like, it's just, I don't know. And the jowls, it just seemed to come on faster as I got closer to 60, where it used to be, I didn't really worry about it. And then all of a sudden it just seemed to be speeding up. So I wanted to slow it down. So I did my best.
And Dr. Solomon, when you first met Rebecca, what stood out, or what did you think? She gave you carte blanche to do what you thought was the best treatment for her. So what did you think? What stood out for you?
You know, it's always helpful when a patient comes in and lets us give recommendations, and they're open-minded to some of the recommendations, not coming in just with one thing in mind, because often the aging process is a process that affects all areas of the face, from the brow area, the mid face, the lower face, and the neck. It's all really one sort of unit that's ascending together. And so when patients are open-minded to rejuvenate it all, they're going to get likely the best results. So Rebecca was great to work with because she was open-minded, and she's physically active and super fit, and she feels youthful and wants to look how she feels. So that's sort of the perfect patient to sort of bring into the practice and to work with, to try to make her as beautiful as possible. So no, it was all aligned and great. And we discussed the pros and cons of different procedures, and then ultimately made a plan which involved rejuvenation of the brow, mid-face, jawline, and neck, and then some skin rejuvenation. And you're now 60, you said.
Yes.
And there's more and more patients at 60 now where the objective isn't to make them look just tighter, it's to make them look as beautiful as possible. And we're seeing 60 being the new 40, 45 kind of thing. And I think you know, right now people looking at you wouldn't have any clue kind of where to put you in the age. I think you look just...
Yeah, thank you.
Well, and again...
What I like is how much better I look too, and it's only been 4.5 weeks.
Right.
Yeah, so it's pretty quick. Yeah.
Yeah. You had a pretty, you know, typical, but, you know, maybe even a bit faster than average recovery, because you were...
That's good to know too.
Yeah. And how did you feel throughout the process? Did you find it was what you expected? Did you find it more difficult, easier than expected, right after surgery?
Right after was, I don't know, I feel like because you're on some pain meds and stuff, you're kind of just out of it. You just kind of floating around. I didn't find any of it that difficult. My daughter took care of me. So, yeah, and I found how much more I like chicken broth than I used to.
Well, that's good for you.
No, I didn't find it that difficult except for taking a little too much meds at the beginning. So I ended up going through half of the first day without meds because you can only have so many per day. So that kind of messed me up the first day. I didn't feel great, but I think it was totally manageable through the whole thing. And I stopped taking them only at night after probably the fourth day.
I have a question for you because a lot of patients come in and when we open the conversation about having an open brow lift with the lower face, some people are like, oh, I don't know if I want to take all that on. That might be a lot. Or when we discuss laser resurfacing in addition to just the facelift, they're like, oh, I don't know if they want to take it on. So you've done it all. You don't know any different because that was the process that you went through. How did you find doing the multiple procedures, doing the brow with the facelift?
I'm really terrified of surgery, period. So I just don't like it. And because I'm healthy, I haven't had to do any, not very much, like wisdom teeth and stuff. But I find that I wanted to do it all at once because I didn't want to go through that 3 times with each thing, right? So if I could do it once, go under and get everything I wanted done and then not have to worry about doing it again. So basically,
Did you find it to be overwhelming having done the brow with the face and the laser? No?
Not at all. Because I was going to be off work anyways, so I might as well just do it once.
Yeah, in most cases, the brow lift doesn't add that much to the recovery. It's just you're already on pain medication, you're on antibiotics anyway, you're going through the laser resurfacing post treatment, so the brow lift's just some extra stitching, really. I guess I can talk briefly about why we decided to do an open brow lift versus an endoscopic brow lift, because there's, every day that we're here, we're sort of talking to patients about different brow lift options. So to make it simple for the audience, brow lift is rejuvenation of the upper third of the face, and it's largely aimed at repositioning the eyebrow. In many cases, we're creating a little bit of an arch to the brow, which may have been there when the patient was younger and the brows descended, but we don't want to create a surprise look or something that looks like a telltale sign of surgery. We don't want to elevate the brow too high. We don't want to make it look too surprise looking.
The ideal position of the brow is for females on the bone or slightly above?
Slightly above the bone. In males, it's on the bone. In females, it's above the brow bone, and it has an arch lateral to the iris of the eye, which is the colored part of the eye looking straight. If you were to take a line and go up on an angle like that, it would hit the arch point of the brow. And a lot of people who do permanent makeup and things are excellent at knowing sort of the anatomy and stuff like that. So we wanted to maintain a natural look, but elevate the brow so that we're rejuvenating the lateral orbital area, which often becomes crowded with the aging process. So some patients come in and they think they need blepharoplasty, but in fact, they actually need brow lifting. They may need both, but we could talk about that in another podcast. But in general, I think in many cases, just elevating a little bit on the corner of the lateral orbital roof over here can really rejuvenate and give a more youthful appearance. So how do we achieve that? Well, either endoscopically through small incisions where we elevate the brow off of its bony attachments, reposition it. And that works very well in younger patients, but it has some limitations in patients with 2 categories, some older patients or patients who have a high forehead. And so in those circumstances, we may recommend shortening the forehead at the same time, which also makes the brow look elevated, shorter, and a little bit more youthful.
Yeah, I can tell.
Yeah, so that's the option we elected to go, because I think I remember talking to you about it, and you said you wouldn't mind if the brow was a
actually
little
have
bit shorter.
Rebecca's pre-op photos here just so we can actually see.
One of the reasons that I could tell was the way my hair was hanging over my face, as opposed to it was kind of back like this. And I'm like, why is it in my face? So that's how I kind of noticed the difference more so.
Right.
Yeah. So you can sort of see her forehead might be a little bit higher.
Yeah, so the distance of the face is divided into thirds, the upper third, mid third, and lower third. And in Rebecca's case, the distance, her hair sort of combed down a little bit, but the very temporal area of her hairline was a little bit elevated. And in those circumstances, it limits where we place the incision for endoscopic. And it's quite a far distance from where we're working. And so some patients with that anatomy are not ideal for endoscopic lifting, and in fact can elevate the brow with the hairline. So you're actually moving the hairline back a little bit, which would not have been ideal in your circumstances. So different operation, but has more that we can achieve with it. in the 1980s, 90s, that was the only way everyone did brow lifts. And then it moved towards more limited incision brow lifts. In our practice, we try to offer both and just utilize both depending on the patient's needs.
So with all that you've endured with the facelift, brow lift, laser, what's the feedback been amongst the people in your world? Do people go, you just look like
I
you look
haven't
great? Or,
told that many people, and it's been interesting when I've gone out, when I've seen someone that I haven't seen for a few months. I don't even tell them at first. I got my hair done yesterday, and she's like, "You look different," but she couldn't figure out what it was. So, and then since I said it, she's like, "Oh yeah, it's so different." So yeah, I think it's a huge improvement, and my daughter really likes it too. So yeah, so I feel good about it.
Well, good. As long as you're feeling good and feel energized and happy that you did it, that's awesome.
No, I love it. I love it. I feel so much better, like self-confidence. I was really like self-conscious of my neck.
So what would your advice be to somebody within the 10 years of your age now? So 50, when do you think is the best time to do it? Or how does someone make that decision?
I feel like a lot of it's your lifestyle, because how you're aging is depending on your lifestyle or how your diet is and stuff. So for me, I think I was able to leave it a little bit longer, but maybe if I didn't want to get to this actual point, maybe, or before I look like that, I probably could have done it a few years ago, but I was in the middle of renovating a house and a lot of work on that, so I couldn't really do it. But I feel like if it was in the perfect world, I probably would have done it a few years earlier.
I also want to mention it's very subjective. So people come in and chat with us about facelift surgery, but it's really subjective as to when the right time is. Because somebody could look at me, and people have, because I had a troll on Instagram say to me, mention and make a comment, they think it's time I get some surgery done. So I haven't had any surgery, but then it's subjective, because then I have patients that come in and say, "Oh, so have you done your eyes, or what have you done? You look really good." And then there's the guy on Instagram who said, it's time to get some surgery done. So it is really a personal choice as to when is the right time. And I'm asking because I think a lot of people debate that within themselves. They start to see the changes, and then they don't really know, should I do it now? Should
I'll
I
come
wait?
clean. I was the troll.
Well, I deleted you.
I had a surgical opening, so I thought I'd put it in.
Tried to fill the day.
I tried to fill the day.
Oh, that's hilarious.
I'm joking, but
I was also thinking about how if someone wasn't sure they wanted to get it done, I feel like maybe if you were thinking about it, that's kind of when you would start saving up for it.
Saving, researching.
And give yourself, if you think you're not ready for it, maybe take a couple years and put that extra bank account aside. Then you can save up for some of it beforehand.
It's definitely a good
advice.
goal.
Yeah. I think that would help a lot with people, because if you're already thinking about it, then put the money aside. So when you are ready to do it, you are ready to go. Yeah. So,
any other advice you have for people wondering when the right time is, or about the experience and the recovery?
I was really, really, really
You mentioned you were super nervous.
Anxiety about doing any surgeries, like super nervous. But then once I did, I didn't find it that difficult. So and I found it very, with what I went through, that I felt very comfortable and relaxed by the people that were around me. It helped a lot. So good bedside manner. My first baby, I had a horrible nurse. She had nasty, I still remember. And she just had no bedside manner. She wasn't friendly. She wasn't sweet. She wasn't caring. She was nothing. She was just...
Well, good people around you can definitely change an experience.
Oh, absolutely.
So I'm glad you had that.
Oh, I had a great experience. That made me so much more relaxed, just a little bit of extra backup kind of. So that helped a lot.
Well, listen, thanks so much for participating and sharing your experience. I think it really helps future potential patients get the courage to make the decision. So for them, I'll thank you, and helping us communicate with our audience about what we do and what can be done, and seeing real life examples is always super helpful. So thanks so much for taking the time.
Thank you for taking care of me.
You're welcome.
Our pleasure.
Thanks, guys, for taking time to listen to our podcast, Unfiltered. We hope it was worthwhile, and we will be back with some more hopefully useful information.